So I think I'm audible. Hello, guys. Hi, I'm Dr. Mahesh Nair, cosmetic plastic surgeon, founder and director of Nipantak Aesthetics, Panampedi Nagar, Cochin. And today, this is my first YouTube live session. So I would like to begin with a very, what I can say, not exactly a controversial, but a burning issue, uh, which most of us, as cosmetic surgeons also have been bombarded with, like, your patients asking you, doctor, should I do a liposuction, or should I do a tummy tuck, or should I do both, or what? There are many of those clients who are like cat on the walls, I would say. Or it's more of a diagnostic dilemma, because sometimes what happens is, it's very straightforward. It's in the face, like the client walks in and you know for sure that, okay, fine, this person needs a tummy tuck. And of course, along with the tummy tuck, liposuction is a part and parcel nowadays. So one is liposuction is a subset to a tummy tuck, basically. So a tummy tuck, some clients are very evident, like, fine, there's a lot of excess skin and we can do a tummy tuck in this case, and that's it. But there are this YouTube live or Insta live is mainly for those people who are in between, the who are in the gray zones, mainly, who cannot decide upon whether they need a liposuction or the tummy tuck, and hence they seek our opinion as cosmetic plastic surgeons. And it is our duty to bring forth all the information to them, what each procedure is about, what is it that they expect from the procedure, what will be their scenario after the surgery is done, what results can they expect, and how long will they last, what is the downtime, so on and so forth. So let me start with very simple things like, so what is liposuction? Now, liposuction is basically sucking out fat from the body, basically from fat resistant pockets, that is, which are, resistant to your diet and exercise, and you could not get rid of that fat. So liposuction is mainly for that. So yeah, we use a cannula, we use an infiltration solution to dissolve the fat or to liquefy the fat inside the body, and then we take it out using the cannula. There are various types of liposuctions: power assisted, ultrasonic assisted. All these technologies are helpful in certain ways, that the downtime is less, the pain is less in the post-operative period, the results are superior definitely than the conventional normal liposuction. All these are there, but the most important is the operator who uses these instruments. It is not like any Tom, Dick, and Harry can get a good result with the most advanced machine. We have seen disasters happening that way also. So it is prudent that you check the credibility of the surgeon first, whom you're going to, how capable, or the board certification, this and that. We constantly keep updating, and today is World Plastic Surgery Day. So on this auspicious day, definitely, I, as a cosmetic plastic surgeon, would like to bring this to the forefront, that you as people should be also aware that who is a cosmetic plastic surgeon, and who is authorized, or expert, who's an expert in conducting these surgeries. It is not that just because liposuction looks easy, anybody can pursue it. A true surgeon or a good surgeon knows what pitfalls can occur in this patient, anticipate those, avoid those, and if at all by chance a complication happens, how to take care of those. So of course, no surgeon or no doctor per se would like that his patient suffers, or something goes wrong. So we take all precautions, but nonetheless, sometimes some mishaps do occur. It's medical profession. At the end of it, it's not something which is 2 plus 2 equals 4. So coming back to the topic, that is liposuction, which by now I'm sure YouTube is loaded with videos, left, right, and center. Like, you put in the cannula, suck out the fat, do this, do that, and so on and so forth. Tummy tuck, or basically scientifically known as abdominoplasty, is a surgery wherein you can take out the excess skin, the stretch mark bearing skin, that is, of the lower tummy, generally seen post pregnancy, but can be seen even after a large amount of weight loss, say like 10 kilos, 15 kilos, 20, 30 kilos, that kind of weight loss. Once when you also have loose skin in the lower abdomen, or even the upper abdomen, or a combination of both. So it is not that just post pregnancy only women are going to get loose skin, or the mommy makeover. There is even daddy makeover now. Even the mothers are concerned as to how wives are concerned as to how their husbands look. And well, everyone is image conscious these days, so all of them want to get fit. I wouldn't say in the most easiest way. Frankly, it is more easier for you to do diet and exercise and get yourself in shape than undergo a surgery. So it requires a lot of courage to subject yourself to a surgery. I appreciate that in all my clients who have come so far and got the surgeries done. Thank you for that, for having bestowed your trust and faith in the medical system and me. So it is, what I can say, a tummy tuck or a liposuction. Yeah, so tummy tuck basically takes care of this extra loose skin, those stretch marks, then the excess fat, of course, which comes with it. And at the same time, you can also strengthen the relaxed out muscles. Suppose the abs muscles are, a little relaxed. So you can like strengthen them as well. And at the same time, you can reposit the umbilicus, or if the umbilicus has been destroyed previously due to a hernia or something, that can be reconstructed. You can also repair a hernia at the same time. So a lot of these things can be done with a tummy tuck, but not with a liposuction. So liposuction has certain limitations which a tummy tuck overcomes, but that does not mean that every person is a candidate for tummy tuck just because it gives, I would say, superior results. Okay. So the burning question that comes to me usually is, which one do I need, or do I need both? Well, you may need both if you have skin laxity. Skin laxity is the crux word over here. If you have loose skin, or see, post liposuction, let me explain. If this is the tummy skin, this is the fat, and below that is the muscle. Okay, we are going to take this fat out with liposuction. Then you're going to be left with this loose skin. Now, if you're in the younger age group, or if your skin has a natural tendency to retract or go back, shrink basically, that is also what we can predict to a certain extent, looking at looking and feeling at your skin quality, the amount of stretch marks that you have in your skin, or how elastic your skin is, the recoil of the skin, and so on and so forth. So these things we cannot tell on a photo, or maybe not even on a video, frankly. That's why for such big cases like a 360-degree liposuction with tummy tuck and all, I personally prefer either a video consultation, the least, or a personalized consultation is the best, because then I can comment more, I can give you more options, more knowledge about how to go about a particular procedure and whether you need it in the first place or not, to be honest. So I would not really like somebody sending like a dozen of photographs and then telling, how much does this cost, or how does this go down. We will give you a very rough estimate then. We cannot really pinpoint as to what will your result be like and how it is going to look at the end of the day. That's beyond our capabilities to do, frankly, no matter how experienced who is and who claims. So that one needs to understand as a client that there are certain limitations. So which one do I need? Yes, I can tell you that confidently once when you come and meet me. So I can brief you up on that. Is this a weight loss procedure? No. Weight loss is a byproduct of these procedures. That too, it will not be apparent immediately. You will be able to see it on the scale maybe like a month down the line or so, when the body has equilibrated with the surgery and the system. That is, we put in some fluid, then we take out the fat, and at the same time we reduce the amount of skin and we tuck it all up. So the body has to harmonize with these changes, and only when that is done will the body reflect its true weight. So it's like post surgery. I have had this plenty of clients, frankly, like you do a tummy tuck and the second week they stand on the scale and say that, doctor, I still weigh the same. As I like, look, you have to come down from that edematous state of yours where all the induration is the hardness that you feel in your tummy or the region that has been liposuction. So all this has to go, and that takes roughly about 3 to 4 weeks. It doesn't disappear overnight. So is it a weight loss procedure? No, it's a body contouring surgery. Either one of them, even liposuction or your tummy tuck. For this, yeah, one needs a consultation, not photos. Yeah, that was another point that I wanted to discuss. BMI is important. The body mass index is very important, because depending upon that, we can predict what kind of result you're going to get. Say, like, suppose you come with a high BMI, say like 38 and 40s and all, definitely you should not, rather, or you will not be able to expect an hourglass figure or something like that, unless your main core is small and you've got just a lot of extraneous fat, which is more commonly seen in women. Men generally tend to have visceral fat. What that means is fat in and around your intestines or your viscera. So that fat is not amenable to, we cannot tackle that with a liposuction or a tummy tuck. We need fat which is outside the muscles. That fat only we can remove. We cannot remove all the fat in the tummy and make your torso look really thin or get an hourglass. Secondly, the height also matters. Suppose if one is quite short, say like 5 feet or 5 feet 1 inches, that's quite a normal height in the Indian scenario. I wouldn't say no. And then be realistic in your expectations, frankly, because as you know that the torso itself is short, we will not be able to carve out a very great hourglass or something like that. It all depends upon even the bony framework. There are some things which are beyond our control. Like, for example, I I cannot change your bony framework, frankly. I can just contour the soft tissues over it. So those are the limitations of any surgery, whether it is done by me or anybody else. It's going to be the same limitation where it exists. So your body form, your body shape, structure is all paramount in deciding whether what result you're going to get. That's why early on in like I think 2 years back, I made an Insta post stating not all tummy tucks are the same, because it depends what you have come with. If the canvas is something different, then the painting is going to look it's going to look different. So the technique is the same, the principles are the same, the way they are executed is the surgeon's expertise. That's where you should be choosing a good experienced surgeon who is akin to these surgeries and who keeps doing them day in and day out. Hence the term cosmetic plastic surgeon. Okay, so can I do what is the next question that I got? The other most important questions between liposuction and tummy tuck that I commonly get is, uh, can I do one now? Like younger women, many a times they come with weight loss. Younger women, what even men have come basically with a massive weight loss. Massive meaning 10, 15, 20 kilos, 30 kilos, maybe 40. And then they have this loose skin. Okay, loose skin and some amount of fat also, which they've regained after that weight loss. So then they're like, okay, if I go in for say upper body lift or lower body lift, lower body lift is somewhat similar to a tummy tuck for all lay purposes. Of course, they are two technically different operations, but yeah, a tummy tuck and liposuction. Can I go in for one now? Yes, you can, provided you're willing to maintain that same result. See, I need some commitment from your end also. It is not that we do the surgery and lifelong the result is going to last. Well, it will last as long as you let it last. It is like when we do a liposuction, we take out the mature adipocytes from there. That is the adult fat cells are basically taken out from the site. But at the same time, there are stem cells of fat still living over there and under good environmental conditions, which I mean a good sedentary lifestyle with a good fat intake and things like that, that promotes growth of fat again. So again, you can get fat. So usually what we have seen is about 2 to 3 years down the line, people sometimes come back post liposuction saying that, oh, now I've again become fat. And then when I ask them things like, oh, I've been having rajma chawal, I've been having beef, I've been having this, I've been having that. Well, if you're not going to take care of your diet and lifestyle, how am I or not going to promise you a lifelong result? So that gets affected over there. Uh, then another common question is, will a pregnancy affect my tummy tuck or liposuction? Yes, of course, pregnancy is a physiological miracle and your body goes through a lot through it because of the hormones. So you're going to have water retention, gain fat, lose fat, a lot of stuff is going to happen. And in the bargain, definitely the muscles are going to get stretched out. Like for example, the gravid uterus or the pregnant uterus is not going to bend your spine. You're not going to get a hunchback, but what you're going to get is a big belly. Okay, so that belly accommodates the what I can say, the growing uterus or the fetus, and at the same time distends or enlarges itself or thins out. So then again, a repair may be necessary. It is not that repair will be needed, because not all babies are of the same size or volume. So the pregnant state may have a larger tummy, smaller tummy. It is all variable. So again, so pregnancy may or may not affect, but 90% times it does affect, and you may have to go in for a repeated tummy tuck. So the other question, yes, which I get asked very often is, doctor, I have a short vacation of 1 or 2 weeks. Can I get a tummy tuck and go? Strictly no, definitely no. I do not want a client like that who's on a horse and who wants to fly out really soon. That is not a good thing to do. So, one second, why is this? Yeah. Yeah. So we need at least 3 to 4 weeks, basically, if we are going to do a tummy tuck, for you to settle and go out safe and sound. Okay, we cannot afford to, at least I cannot afford to let go of my patient in a week's time post tummy tuck. Liposuction, tummy liposuction, back liposuction, yes, definitely in a week or 10 days or maximum 2 weeks, you can fly out, or go back to your city. There's no problem, or you can go on your vacation or something. But a tummy tuck, yes, basically needs some more care, because there are some tummy tucks, especially the high BMI ones, high body mass index ones, who usually require weekly dressings for at least 3 or 4 times. So it is not that they may have an infection or they may have something, which requires hospitalization or something, but at least it requires a sound, a good expert to have a look at it when needed. I need you to be accessible to me, not somewhere really far off where I get images stating that, oh, doctor, now I can't take this. I have to go and get admitted myself to a hospital. If it comes to that, definitely we are there to help you out. There's no doubt. But usually it does not reach to that level because we are involved with you, holding your hand right from before the surgery to till you actually settle down in your social life. So we ensure that you bounce back to your normalcy. So it's a lot of hand holding is involved in this, trust me, but it is worth the effort, because the smile that we see at the end of it all, like a post liposuction or post tummy tuck, it's more than anything else, it cheers us up as well. So we are also very delighted to see that somebody has transformed. You can fit back into your older clothing, you can wear the dresses that you have always aspired, and along with this you also notice that you have a weight loss happening with yourself, and you start feeling good, you start exercising, you start working out, you eat healthy, you live healthy. So it acts as a morale booster as well. So all these liposuctions, tummy tucks and all, they do have a psychological influence also. Generally, it's like mens sana and corpore sano. So it's like a healthy mind and a healthy body. So if the body is healthy, the mind also remains healthy, and vice versa. So next is, am I a good candidate for either? Yes, a sound mental health, physically fit, preferably a non-smoker. Smoking detrimentally affects a lot, especially the tummy tuck result, the flap vascularity, that is the blood supply to the to the skin tissues, skin and the soft tissues basically, is very precarious post tummy tuck. So one has to be very careful. That's why we do not give very tight pressure garments also, and we periodically monitor you, how the skin looks now, how are you healing. Everything matters. On top of that, if you are a smoker or you have been a smoker and you have lied to us that you have not been, so that is like a recipe for disaster, trust me. And the ultimate losers are the clients who hide such data from the doctor. Of course, we feel bad that our result is not up to the mark. We have invested like 5-6 hours behind this of our hard work, and passionate hard work, I would say, in getting the surgery done and making you look fit. But at the same time, we wish that you are just as responsible in giving us the correct feedback, the correct data, or the correct what I can say, pre-operative data that we need, the information that we need, whether you're a smoker, whether you consume alcohol, whether you do hookah, whether you do shisha, or whatever that you do, just inform us, let us know. Don't hide anything from your doctor. The old adage holds very true even in today's date. In spite of all the technology available to peep inside you with a CT, MRI, PET scan, get a drug analysis, then this, then that, then. But all said and done, that trust factor matters a lot. Please discuss with us whatever comes to your mind. I generally don't believe in one consultation for such surgeries. I like 2 or 3 consultations wherein I discuss things out with my client, whether you really need this. First is like you talk, I listen. Second is I talk, you listen, and the last one would be we both talk and we come to a conclusion as to what needs to be done about this. So I want you to be as involved in the procedure as I am, rather than just going what I can say, rather than just a one-sided affair kind of. So, one second, what is this? I don't know, I think I'm live still. Okay. So, yeah, so let's proceed ahead further. So, liposuction and tummy tuck, yes, they form an important part of mommy makeover or daddy makeover, but definitely they are not the only things, because in a mommy makeover, you also have a breast reduction, or maybe a breast lift, or an arm liposuction, a chin liposuction, something or the other can be tweaked, a thigh lipo, a lot of things can be done. So that's a mommy makeover. Similarly, a daddy makeover, the dad bod, you relieve them of their paunches or bellies, and you sculpt the chest, you sculpt the arms. So a lot of things can be done in a mommy or a daddy makeover. They again, if liposuction is a subset of say tummy tuck, then tummy tuck and liposuction combined are a subset of say mommy makeover or daddy makeover. It is not that men do not need tummy tucks. Even men need tummy tucks many a times, because post liposuction they may have loose or sagging skin. So what I have a two-pronged approach in this. I mean, a bi-directional approach. If a patient with a dilemma comes to me, like whether I need a liposuction or whether I need a tummy tuck, male or female, irrespective of that, I try to see their social structure around them, whether they have any help, whether how long are they there around me, like whether they are staying in the same city, whether they're staying somewhere far off, what are the logistics, whether they can take a tummy tuck or not in the first place. Also, some are really scandalized by the scar that goes on the tummy. Frankly, it's a very tiny, not a tiny, but a very fine scar that goes very low down on your tummy such that it gets hidden in the, what I can say, the skimpiest undergarment. Well, not the skimpiest, but at least a decently normal looking undergarment. It definitely conceals our scars off. There is no doubt in that. And the only telltale signs what may remain is around the umbilicus, where there's a fine scar that settles down with time. So don't panic, don't worry. Initially, it all looks a little angry, but later it all settles down really, really well. Later meaning, I mean by 6 months to 1 year. The body takes that much time to settle down everything. 3 months, 6 months to 1 year. Some settle faster, some settle slower. So, where was I? Yeah, a mommy makeover or daddy makeover. So the dilemma whether I should do a liposuction or a tummy tuck. One approach to this is, if you are in a doubt, let's get a liposuction done first, provided that there is not a large amount of excess skin, wherein I feel as a surgeon this skin will retract, okay, and it will go back, and you will get a decently good result without going in for the more what I can say, not debilitating but more invasive tummy tuck. Okay, we'll just put small keyholes at concealed areas in the creases where nobody can practically see. You go in with the liposuction, ultrasonic, power assisted. We have it all. So you go in from there and you take out all the fat and come. And then you may have a little loose skin initially, but don't worry, it doesn't hang because we give you pressure garments and all for at least 6 to 8 weeks. They are to be worn diligently. Don't remove them and let the swelling come out. It's a very bad thing to do. Listen to your doctor always. And yeah, so the garment is necessary in that kind of a scenario, and that helps the skin retract. Then we observe you at 3 months, 6 months, say a year. And most of the times I've observed that the patients which I have told that the skin will retract, the skin has retracted and they do not land up needing a tummy tuck. So that basically tells that our judgment does help us, but I wouldn't say it helps in 99% cases, but there are those 1% wherein the skin, as we expected, didn't retract, or the patient is not satisfied with the amount of retraction. They wanted more. So when the demand is for more, then you need to go a little bit more ahead, not just liposuction. That is the time when you need a tummy tuck. So maybe we do the liposuction now, and 6 months to a year down the line, we can also do the tummy tuck. It's not that post liposuction we can't do at a later date. We can very well do everything. That's not an issue. So that time also we may have a liposuction which will feather the fat out, like feathering meaning it will equalize the fat distribution the way we want it in a good contour and take out the excess skin. So that is also an option. It is not like just because I have told you a tummy tuck, you have to go in for one now. This is why I ask you to understand and participate with me in the procedure. Like, what am I being subjected to as a patient? What should I be looking forward to? What is going to happen to me? And how is this going to affect my life? All these questions need to be asked to me when you meet me, and I'll be able to tell you this based on your scenario. It's completely customized. So don't break your head or overthink, thinking, oh, my this vacation is pending, my job is this, my this is that, and how do I accommodate the surgery in between? Ask the expert. Ask me at least. In person, like whether is this possible, doctor? Can I have in 3 weeks? Can I finish this? And then if it is possible, I'll give you an honest opinion. If not, well, you can always find better time later for yourself, and it's time for yourself, so you better find it sooner or later. So that's that. And why are both these procedures complementary? Yes, because both of them enhance each other's result. Like, say, if the result what I get with just a liposuction is not up to the mark, maybe say with the one which I get with a tummy tuck with a liposuction. So definitely tummy tuck enhances the result of my lipo. And I can't say vice versa. Vice versa too sometimes, because there have been patients who have come from other surgeons who have done tummy tucks, and maybe a couple of years down the line they say like, okay, doctor, now the skin is tight, but it's just that I need some amount of liposuction. That also is possible, that also is done, and it gives really fantastic results. There's no doubt in that at all. At that point of time, basically in revision surgeries, it depends on the skill of the surgeon also. Like, sometimes it may not be just fat inside, it may be scar tissue or fibrous tissue due to the previous surgery. Okay, and how one tackles that is also very important. I cannot make tall promises telling, touching your tummy, that, oh, it looks all soft, so this is all fat and it's going to come out. No, there are many times, in fact, when it is not fat, it is the soft tissue or the fibrous tissue that is regenerated there, and we cannot take that out with plain liposuction. So in that kind of scenario, it is again, what I can say, necessary to either do something like a mini tummy tuck wherein you get rid of that extra loose skin, or you can go in for a full-fledged tummy tuck. That again depends on what kind of canvas you get for me to work upon. So that's that. And okay, what can I expect from these procedures? That's what I was telling for so long. So liposuction will give you good results, modest to good results. In some cases, really outstanding also, wherein you don't need to do any other procedures. You're like, wow, voila, one liposuction and that's it. You don't need anything more. The torso, normally we address the torso, the flanks, the sides, the back, the love handles, the upper back, lower back, wherever we find pockets, we just take it out. We are not going to leave any fat pocket over there for you to, grumble about later. Like, doctor, you removed so much, but this one is left over here. No, that's not the idea. So whenever we go, it's like we sweep out all the fat and we come. So that's when we ask you also whether you want this fat to be grafted anywhere, because this fat is good fat, the lower tummy fat and all. So if you need, say, a butt lift, or you need fat in the hip dips, or you need fat in the breasts, or maybe a small facial fat grafting, all this can be done with the sitting. Of course, I do not like to combine a lot of surgeries together. I'm not of that opinion. I don't like exposing my patient to a 9-10 hour anesthesia. I would love to keep any surgery below 6 hours. That's the safety limit. That's a safe time, and you recover very well. You are not traumatized by the surgery, and you don't get paranoid thinking that, oh God, what did I get myself into? That doesn't happen. Of course, generally tummy tucks and all, we do have an overnight stay. In fact, even a 360-degree liposuction, I prefer the patient staying back with me overnight, and that has really helped me, handhold them to, get back, kind of, not that they are so down and out, but it's just that, a doctor's touch at that point of time matters a lot. Knowing that some expert holding hand is there with you, it makes a lot of difference. I have personally experienced it as a patient also, when I was not the governing or deciding doctor, and it makes a lot of difference. One handshake, one handhold, one pat on the head or something like that, that makes a lot of difference. So overnight stays are sometimes necessary in these kind of procedures because they are extensive. There is a lot of fluid shifting that has happened, electrolyte shifting that has happened. So I do not want you to go home with a dizzy head, heavy head, or you fall down somewhere fainting and all. No, that is not acceptable to us. So yes, downtime with liposuctions, say the tummy lipo, back lipo, and all, normally is about 1 to 2 weeks, 10 days to 2 weeks, max to max, not more than that. You generally come out very well. The pain usually is there for about the first 4 5 days. After that, it really comes down. Rather than the pain, it is more of a discomfort. I wouldn't say liposuction is painless. Liposuction is a little painful. I definitely would vouch for that. But the modern day painkillers are very, very effective in getting down the pain. And trust me, don't worry, we don't bombard you with so many painkillers that your kidneys or livers go for a toss. Nothing of that sort happens. Be rest assured of that fact. So pain is basically taken care of. Your swelling is taken care of with the garment. Do wear the garment as instructed by the surgeon, or whatever garment they have given. It makes a lot of difference. 30% of the result is dependent on the garment, I would always say, because it compresses the tissues, and it helps them mold better. At the same time, when we see that, suppose the skin flap is not getting enough blood supply, or we see those tiny black spots near the suture lines, that we have taken, and we know that there is some kind of blood supply paucity or deficiency over here, we ask you to stop wearing the pressure garment for some time, just so that the blood reaches that particular region. So that is very necessary that you communicate with. This is the reason why I ask my tummy tuck patients especially to stick around for at least 2 to 3 weeks. I do not want them flying out of the country at the end of 1 week saying that, oh wow, very quick tummy tuck has been done and now I can go. That can be possible in ideal case scenarios, wherein that has been possible also in some clients of mine who have a BMI of say 25, 26, which is like very much in the ideal range, and they get a phenomenal result, an hourglass, whatever you call it, six pack abs and all, and they fly out soon enough, 10 days or something like that, because everything is settled. All the sutures are generally absorbable. We don't have to come for any stitch removal or something. Even for a liposuction, the port sites are closed. Nothing is as such dripping, oozing, or anything of that sort. Yes, after such an extensive liposuction, for the first 48 hours, some amount of ooze may be there, a little fluid trickling down, but that's okay. That settles down in 48 hours. It doesn't last. It saves you of a drain, of course. But in a tummy tuck, sometimes, in fact, most of the times, drains are necessary, because especially when we go for this 360-degree liposuction with an extensive tummy tuck, wherein we bring out about like nice 3 to 4 kilos of tummy skin is out. That is the time when we prefer putting drains, because it has been seen that when you don't use drains in these kind of cases, it leads to fluid collections, and which can get secondarily infected and lead to disastrous consequences. So we don't want that from happening. So it's a precautionary measure. That's all. There are tummy tucks which I do even without drains, But again, those are the ideal BMI ones, which just have the excess skin and there's not much of fat. Wherever there's excess fat, we need to go in for a drain preferably. So fat means drain, that is for sure, kind of. Sorry. So that's that. Downtimes. I'm sorry. Okay. Post-op protocols. I just discussed the post-op protocols. Sorry, guys. I think I need some water. Yeah. So post-op protocols are basically what we just discussed. Just stay in touch, and I can explain you the rest. Walk you through the remaining post-operative period, wherein you don't have to like stress it out, saying that oh my god, now I'm far away from the doctor. What can I do? So don't let that scenario creep in. And as far as this Insta live is concerned, I mean YouTube live is concerned, I think I've answered a lot of queries that came up to me in recent times. And the cat on the wall client usually who doesn't know what to do, a liposuction or a tummy tuck. And I think I've done justice to the time. And it's about half an hour already done. And if there are any more doubts or queries, feel free to ask in the comment section below. And if you want to suggest any more good topic that I should come up with, please do let me know. Whether this is comfortable or an Insta live, that also please let me know, because Insta live is technically more easier to conduct as compared to a YouTube live. But then YouTube, sometimes the clientele is different and it works out better. So it's up to you guys. Just decide and let me know what I can do. And definitely, I'm here to enlighten you, to disseminate knowledge, or whatever that I know of the topic, and I can help you with that. Thank you so much for your patient listening, and see you next time. Thank you. Bye bye.